Let's paint a picture. You have a load of 100 kilograms to lift. So as to enable a lot more to be achieved without that load, you turn to your lifting equipment and find that you only have the capacity to lift, say, 1 kilogram. Well, how do you even start? The Task Force on Mental Health recommended that the government declares mental illness a national emergency of epidemic proportions. But currently, only 0.01% of the budget goes to funding this, and only 1 in 10 facilities offer the services. Helen Aura reports on the situation and how the ministry hopes to help lift the 100 kilograms ahead of tomorrow's budget reading.
This may look like your ordinary day in the streets of Nairobi. Your ordinary people going about their activities. But beneath the masks of apparent normalcy are tales of emotional and mental turmoil. 1 in every 4 of these people, of Kenyans, suffers or has suffered a mental health condition, according to the World Health Organization.
People with mental health conditions often experience severe human rights violations, discrimination and stigma. Guidance on effective evidence-based care is available, but provisions of service is lacking in many areas. This includes poor financing for scale-up of services, leading to extremely low treatment coverage.
The allocation to the 2020-2021 health budgetary allocation stands at 119 billion shillings. And with health being a devolved function, the ministry is hopeful that there shall be an increment of resources in the 2021-2022 budgetary allocation. And with mental health declared a national health concern, more needs to be done, not only financially, but on community levels.
According to WHO, around 20% of children around the world also suffer from mental health issues, with suicide being the second leading cause of death among 15 to 29-year-olds. Further, it ranks Kenya as the country with the 4th highest number of increased mental health patients in Africa. 1.9 million Kenyans suffer depression. The need to upscale the number of professionals in the field is dire, as only 13% of facilities in the country offer mental health services. This with only 100 psychiatrists in the country and less than 500 psychiatric nurses. Further, 50% of people who go to hospital are depressed. Men are 2 times likely to commit suicide than women. Only 11% of the facilities offer treatment for depression and psychosis. With the stigma that surrounds mental illness, 5 out of every 6 persons who suffers mental illness do not receive treatment.
0.01% of our health budget goes to mental health services. That's a little drop in the ocean.
The ministry is looking to increase the annual budget for Mathare National Teaching and Referral Hospital from 200 million to 1 billion shillings.
National and county governments will be expected to dedicate resources towards the establishment of user-friendly mental health infrastructure, amenities, including ICT-based services hardware at community and primary care level, and to ensure consistent supply of essential high-quality medicine equipment and technologies.
The numbers of Kenya's mental health status are easily numbing. The reality of how much needs to be done to effectively manage the situation is a wake-up call on how much not only government but also wananchi ought to do to help everyone mind their minds. Helen Aura, NTV.
Yeah, certainly something that does need to be prioritized.